Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
How teletherapy fits into ongoing psychiatric treatment plans for chronic conditions. Chronic psychiatric conditions don't follow a set timeline. Depression, anxiety disorders, bipolar disorder, and PTSD are some of the conditions that often require consistent care over months or years, not a single acute episode with a clean ending. That reality is part of why teletherapy has become more than a convenient option for many patients. It's become a core part of how long-term care gets delivered. In 2024, SAMHSA reported that 33.4 million U.S. adults received mental health treatment via telehealth. Among adults with serious mental illness specifically, that figure included 48.3%, or roughly 7.1 million people. This podcast explains how teletherapy integrates into ongoing psychiatric treatment for chronic conditions, how it supports consistency, what roles it plays across a full care plan, and where the real clinical limits still apply. Teletherapy is already embedded in routine psychiatric care. Teletherapy didn't start as a permanent feature of mental health care, but it has become one. A 2024 NIMH-funded study by Cantor and colleagues, which used a secret shopper approach to contact more than 1,900 outpatient mental health facilities, found that 80% of the 1,221 facilities accepting new patients offered telehealth. Among those facilities, 97% provided counseling and 77% provided medication management through virtual visits. That pairing matters for chronic care. Patients managing a long-term condition typically need both regular sessions and medication oversight. The fact that most telehealth offering facilities cover both signals that teletherapy can function as part of a real, ongoing care structure, not just a workaround when in-person visits fall through. How teletherapy supports multiple layers of ongoing psychiatric treatment. A chronic psychiatric treatment plan usually has several components working simultaneously. Behavioral health telehealth covers one-on-one therapy, group therapy, medication prescribing, medication monitoring, mental health screening, referrals, and symptom monitoring for depression and anxiety. That range matters because chronic care isn't a single intervention. It's an ongoing process that shifts depending on where the patient is. Online therapy can support each of those layers. A patient managing bipolar disorder might need regular sessions, a monthly medication check-in, and symptom tracking between appointments. Telehealth can handle all three without requiring a separate in-person trip each time. Telehealth and behavioral health settings can support mid-course treatment adjustments, track patient progress and outcomes, and monitor compliance over time. That kind of ongoing adjustment is exactly what chronic care demands. Using teletherapy for therapy and psychotherapy over time. Regular psychotherapy, whether CBT, interpersonal therapy, mindfulness-based approaches, or supportive counseling, has been delivered virtually for years, and for most chronic conditions, it fits the format reasonably well. Skills-based sessions, group formats, and longer-term talk therapy can all be delivered via video without losing what makes them useful. A 2025 program evaluation by Stein and colleagues examined the VA's National Bipolar Disorders Telehealth Program. Among the 815 veterans who completed both initial and post-program assessments, depressive symptoms fell by 29.3% and manic symptoms by 16.6%, both statistically significant improvements. Bipolar disorder requires some of the most complex long-term psychiatric treatment there is. Ongoing mood monitoring, relapse prevention, and coordinated medication management. The VA program results don't generalize to every clinic or every patient, but they do show that structured virtual care can sustain real clinical work over time, maintaining consistency and continuity. For chronic conditions, consistency isn't optional. Missed sessions accumulate. Gaps in care can lead to delayed medication adjustments, symptom worsening, or relapse. HHS Best Practice Guidance for Behavioral Health Providers identifies continuity as one of telehealth's central advantages, and for good reason. Transportation, childcare, work schedules, physical fatigue, and mobility issues are all real reasons people miss appointments. Teletherapy doesn't solve every barrier, but it removes a specific and significant category of them. A patient managing treatment-resistant depression who struggles to travel to a clinic twice a month may be able to keep every virtual appointment. That steady attendance is part of the treatment itself, especially in chronic care, where the relationship with a clinician is built and maintained over time. What clinicians consider before using teletherapy long-term. Online therapy works best under specific conditions: private space, reliable internet, a platform the patient can use without stress, and a backup plan when technology fails. Those conditions aren't universal. A 2025 study by Ettman and colleagues found that patients in low deprivation areas had meaningfully higher odds of telehealth use for psychiatry visits compared with patients in high deprivation areas, with an odds ratio of 1.67 over the 2020-2024 study period. The researchers did not find evidence that teletherapy improved access for patients in higher deprivation areas. That's a real limit. In-person care also remains necessary in situations where virtual sessions simply aren't clinically safe. This can be in crisis evaluation, severe symptom escalation, significant suicide risk, psychosis, or a home environment without privacy. Any long-term care plan that includes online therapy should also define when those in-person thresholds apply. Teletherapy as part of a hybrid, evolving care plan. Most long-term psychiatric treatment is neither fully virtual nor fully in-person. It shifts. A patient might start with weekly in-person sessions during an acute phase, move to virtual maintenance visits once stable, then return to in-person care if symptoms worsen. That pattern reflects what the research supports. Teletherapy extends and sustains care rather than replacing the full structure of it. After the COVID-19 public health emergency ended, the availability of telehealth-based psychotherapy became more conditional. Facilities were more likely to say it depends when asked. That's not a sign of decline. It's a sign of clinical integration. Virtual care is increasingly built into deliberate, evolving plans rather than offered as a default. Let Zeam help you build a plan that lasts. Teletherapy works best when it's woven into a plan with intention, not bolted on. Roles need to be clear. Boundaries need to exist. and the plan itself needs to shift as symptoms, schedules, and life circumstances change. That's how we approach it at Zeam. Our team across Sacramento, Roseville, and Folsom combines teletherapy with psychotherapy, medication management, and other evidence-based care tailored to each patient's long-term needs. If you're living with a chronic condition and tired of care that doesn't keep up, reach out today. We'll help you put together something that does. And on our next episode, we will be covering how clinicians choose between TMS therapy and ketamine therapy, both treatments for treatment-resistant depression and other conditions. You won't want to miss that one. Until next time, have a great week.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.